Well, good morning, everybody, and thank you again for coming out. As of 8 p.m. last night, we had 22,275 tests in New South Wales, and as yesterday, I made a comment around the almost 19,000 tests. The numbers are far too low, and my message today is, again, if we're going to succeed in staying ahead of the COVID pandemic, testing is crucial in large numbers so that we can be confident in the data when we're making decisions as we progress going forward. Now, the 22,275 tests, can I just say thank you to everybody for coming out? Because, you know, without that, we're not going to be able to make the decisions we do as a government. But we do need to increase those numbers. If you look at the 10-day period from the northern beaches during the Christmas period, there was 380,000 tests done in 10 days. At its peak, a day of 70,000 tests. So we know as a state and we know as citizens that we can actually do this and do this very, very well. So my plea today for those in Western Sydney, please come out in numbers. If you've been tested previously, but you're still feeling unwell or you have a symptom, get tested again. If you have a symptom, get tested. If you think you've visited an area that is on the list in relation to those areas that we're concerned, some venues, then please get tested. My call out to Western Sydney today and to New South Wales is to get tested. The same in Wollongong. We noticed that when we had those cases in Wollongong, the numbers had increased, and I do thank again those people of Wollongong that came out to get tested, but we've seen that testing numbers drop in the Wollongong area. And so today my call again is to come out and get tested. Let's see how as a state we can actually again bring the numbers up, 30, 40, 50,000. As I said last night, as of 8 p.m, there was 22,275 tests in New South Wales. Of those tests, there were 7 cases. All 7 cases were from overseas and all in hotel quarantine. There are 0 locally acquired cases in New South Wales today. Now that is good news, but we also get data overnight, and we normally wait for the next day, but it's important this morning we talk about that we've already identified 2 cases overnight connected to the Barilaro BWS. So again, my message to everybody, even though today we are talking about a 0 day of locally acquired cases, it is important that we keep that testing regime up, and that is my message. Knowing that already overnight there are 2 cases that will be part of tomorrow's official announcement. Can I just say again thank you to everybody, to the frontline staff, for those that are really getting out on the front line to make sure that we do the right thing as a state. We've also got to do the right thing as a state when it comes to masks. That is very, very important. The masks that are now mandatory as of today, enforcement will happen today, are important. Why? Again, because of mobility. We don't want to see further restrictions. We don't want to go into lockdown. Now, can I make this absolutely clear that we leave everything on the table. But I can make this clear today, there won't be any lockdown of the Cumberland area. There won't be any lockdown in any other parts of Sydney. The restrictions that we have in place are strong enough to deal with what we have in front of us. And of course, the mandating of masks gives us the ability for mobility and to go forward. So with that, I'll ask Dr. Kerry Chant to talk further about the overnight results and those extra 2 cases that we've already identified this morning. Then we'll go to Minister Hazzard, and again I will ask Assistant Commissioner Mal Lanyon to say a few words on behalf of police.
Thank you very much. So as the Acting Premier indicated, New South Wales recorded 0 new locally acquired cases in the 24 hours to 8 p.m. last night. There were 7 new cases were acquired overseas and in hotel quarantine, and this brings the total number of cases to 4,776. There were 22,275 tests reported to 8 p.m. last night, which is up on the previous day. But again, we're urging those test numbers to well exceed the 30,000. So that's the challenge I put to you. So we're particularly urging residents of Western, South-Western Sydney and Wollongong to come forward with even the mildest of symptoms. As the Acting Premier indicated, we need to see those testing levels sustained, and that's because people were at those exposure venues for a number of days, and we need to have those high rates of testing, because even if you were exposed, some people will only develop the illness 14 days, up to 14 days since their last exposure. And so we need those testing rates to be maintained at very high levels to give us that assurity we're not missing those undetected chains of transmission. So despite reporting no cases, there have been 2 cases overnight. One, a gentleman in his 40s who visited the BWS Barawa on the 24th of December, and another case, a female in her 40s who also has some association with the BWS and the Woolworths at Barawa, but those investigations are ongoing. And can I thank those individuals for coming forward for testing and also for their cooperation with the investigations. So just to summarise, the Barawa cluster originated from returning overseas travellers, and then there was a healthcare worker, person who was involved in the transfer of those patients, and then that person passed it on unknowingly to a close contact, and that close contact went to the BWS. Can I just stress that at the time where the person entered the BWS, they had no symptoms and no reason at all to think they had COVID infection. And it really is important that we all bring that to mind, that any time we're out and about, someone could have COVID, and that's why we need those universal precautions of keeping that physical distancing and the mask wearing, particularly in those indoor settings. But we are asking the cooperation of people, anyone who attended the BWS or Woolworths in Barawa Shopping Centre on Sunday the 20th of December between 12:30 to 2 p.m, are being urged to get tested immediately and self-isolate until a negative test result is received. Now that is a long time since that period, but what we want to do is pick up any people that may have been transmitted, then to assist us in blocking any further chains of transmission. It is critical that anyone who attended the BWS store between the 22nd of December and the 31st of December, even for a very short period of time, a few minutes during the times listed on the New South Wales Government website, gets tested and isolates for 14 days, regardless of the result received. We are deeming everyone close contacts. And remember, what we're also advising is that your household contacts should remain isolated until you've got a negative test result. And then from the point that you get tested, you need to effectively have isolated from that household group. If there are difficulties with isolation within households, health has arrangements in place where we can accommodate close contacts to support people effectively following the public health advice. And anyone who attended Woolworths in Barawa Shopping Centre on the 24th of December from 9 p.m. to 9:30 p.m, on the 26th of December from 7 to 7:30 p.m, and the 28th of December from 7:15 to 7:45 p.m, and on the 31st of December from 10 a.m. to 12 noon, is asked to immediately test and self-isolate until a negative test result is received, and then for them, they need to monitor the symptoms, and if they get symptoms, get retested. But whilst we're talking about people who attended the venue, it is important that anyone in that community, that broader Western Sydney, South-Western Sydney community, also comes forward. There is a chance that someone has unknowingly passed it on and the direct link to BWS won't be made. So please, everyone in that community, come forward for testing with the most minimum of symptoms. Thank you.
We still need, right across New South Wales, to have people ensure that they take the necessary precautions. We still live in a COVID environment across the state. The lessons that we've learnt that have kept us safe are essentially maintaining that 1.5 metre social distance. If you have any symptoms whatsoever of cold or flu-like illness, then you must get tested and self-isolate until you get the results. And of course, we've added to that, in addition to the hand hygiene aspects now, masks. Masks in indoor use, particularly in the greater metropolitan area. Now that is absolutely crucial. So we now have 4 layers of defence that we're working with, and we're asking the community across Greater Sydney to absolutely recognise that the use of masks now is mandatory in most indoor situations. So if you're going shopping, if you're going almost anywhere indoors, you need to wear a mask. If you're in public transport, you need to wear a mask. The police, the government don't want to be fining people $200 if we can avoid that. That's not what it's about. It's about just asking the community to come with us. I have noted that there have been some demonstrations in the last 24 hours indicating that some people don't like the idea of a mask. Well, if they don't like the idea of a mask, stay home or stay outside. You don't have to go into the shopping centres and put other people at danger. So there's a way of actually balancing these issues. Find the balance, some common sense and some care for your fellow community members. Can I also just say to regional New South Wales residents, the use of a mask is not compulsory indoors. But I would say to you as Health Minister that it would still be safer for you. We're hoping this virus is contained, and we are doing everything we can on the basis of health advice to contain the virus. But there's no guarantee in a COVID world. There is no guarantees. So for those of you in the bush, in the regions, please consider using a mask. Don't feel embarrassed about it. You're doing what you should be doing in terms of leading the way to wear a mask if you can. You don't have emphysema, you don't have other health issues, wear it. It's the safest thing. And I just emphasise again, though, it is only the 4th level. So stick with those 3 other aspects. The 1.5 metres, keep your hand hygiene, and self-isolate and get tested if you have any of the symptoms of a cold or flu-like illness. You'll save yourself, but you'll save your family and you'll save your community. Thank you.
Thank you, Minister. Good morning, ladies and gentlemen. As of 12:01 this morning, the public health order in relation to the mandatory wearing of masks became enforceable. That health order provides a $200 fine for individuals who do not comply with the health order. I've been very clear that police will look for compliance from the public in the first instance. The public have been magnificent in the way they've responded to the health orders, and we're seeking the public to wear masks to ensure both their own and the safety of the rest of the community. Where people will not wear a mask or will not comply with the health order, then we will enforce the health order. And as I said, there are infringements available for $200 for individuals who don't comply. It's important to point out that whilst the majority of the public continue to do the right thing and continue to ensure the safety of their fellow community members, there are examples where people blatantly disregard the public health order. Several recent examples include a 27-year-old female from Cronulla who has been ordered to self-isolate in Byron Bay. She has received 2 infringement notices in the past 3 days for failing to comply with that health order. That obviously puts the rest of the public and herself in significant danger. A wedding operator at Fairfield, police responded to a particular report on Saturday night that there were too many people in a wedding venue. On attendance there, police saw that there were 600 to 700 people in that wedding venue, which is almost double what was allowable there. We have taken action and we've issued a fine of $5,000 to that operator to deter that sort of practice. Can I say overwhelmingly corporations and businesses are complying, but it's important that we take a very strong action when people don't do, because the potential health danger of that type of incident, having that many people in a particular venue in contravention of the order, is significant. Thank you.
Dr. Trump, the Australian Medical Association has released a statement saying that the Sydney cricket team should not go ahead with crowds, and also saying that a disproportionate to the measure that New South Wales has taken so far. Why would you have advised?
Look, I'd be happy to brief the AMA on the circumstances around the Sydney test and our thinking. It's important to understand that the restrictions really have gone back to a level, except for the mandatory mask wearing, that were in place prior to our easing of restrictions. And so the level of restrictions we have at this current time are similar to what we've got in place around probably earlier December.
But they say that it's on top of the mask wearing, that it shouldn't go ahead with the new measures with masks that have come in.
So as I've indicated, we have been looking at the plans and we've provided our advice to government. Those announcements will be made. We have certainly taken the matter seriously. We are concerned about the Barilaro cluster in particular and putting in a range of strategies. It's really a matter for those discussions to continue, but we will continue to reassess and provide the best public health advice. But can I just say that anyone who is attending that match, the same message, we can't be sure that no one is going to attend the SCG, but what we're trying to do in our public health strategy is making sure that you don't have a super spreading event. That is the principle. So, and everyone has to be aware that they could be going to a hospitality venue, they could be going to someone's home. So we know that households are the greatest risk of transmission, and I've been messaging that strongly, but also we've seen other hospitality settings and other things at risk. What we're doing is aligning those measures in terms of the capacity caps and a range of other measures to reduce the opportunity for one person who attends those events to infect multiple people. Now, we saw at the Avalon cluster what occurred there was with more people in terms of a setting, and some of the behaviours, singing, dancing, some of the behaviours we've actually talked to you repeatedly about in terms of the increased risk. That leads to an amplification, and then there was a separate group where a number of people then went on who were infectious to the BOLO, and then that led, again, amplified further. So that's the issue, that across the board there will be positive people in any setting you go in. What our measures are trying to do is reduce the chance or reduce the number that an individual person can infect. We're also trying to decrease mobility and decrease the intersections of social groups that don't normally mingle. Also, it's really important that some venues are controlled because we actually understand who's attending those venues, and we can take other risk management strategies. So I'll leave it for government to articulate the approach to the Sydney Test match, but that's some of the thinking that we're having. What we're trying to do is we obviously consider public transport a risk, and Transport have extensive plans around how they can manage that. There's obviously private car transport to the SCG as well, and there's also been extensive planning to manage those mingling points, because that's really what we're concerned about. If one person doesn't come in contact with many, the people they're likely to infect are the people that are they've gone with, actually. And if they're not at the Sydney Cricket Ground, they'll also be potentially at home or having a group at home. So these are sort of the balancing acts, but we are providing our public health advice, and it's a matter for government to assess that.
Epidemiologists such as Mike Toole of the Burnett Institute have suggested that it would be a good idea to vaccinate patient transport workers. What do you make of that suggestion?
Look, I think that the ATAGI, the matter for who is prioritised for vaccination is enforced by the ATAGI, which is the Australian Technical Group on Immunisation. That's a long-standing expert group that will prioritise the vaccine and the groups. It's actually already indicated that in its thinking, in its broad thinking of the groups, the elderly, people that are at our quarantine borders, and healthcare workers, are clearly a priority. And the rationale for that is that they're most likely to be exposed to returning travellers that have COVID at that time. So clearly that's factored in to the thinking, and they've actually published that already in terms of their advice. There is no vaccine that is registered in Australia at this current time. So there is no vaccine that is currently licensed by our Therapeutic Goods Administration. Can I just say that the Therapeutic Goods Administration is an important regulatory body, and it will determine, after reviewing all of the evidence, that it has to satisfy itself about the safety of the vaccines, and then ATAGI will also provide technical advice about which groups, if we've got multiple vaccines, which groups will be prioritised for which vaccines, and what will be the dosing strategy. So there is no vaccine registered. Clearly everyone, and let me tell you, I'm looking forward to having a safe, effective vaccine, but it is important that we go through those regulatory steps to ensure that the public in Australia has confidence that the vaccine that is being rolled out is safe and effective, and we have technical experts. TGA is a regulator, and then ATAGI is a technical group that tells us which groups should get which vaccines.
Can you confirm what sort of protections the public transport workers that were transporting overseas travellers to hotel quarantine. What protections are there in place for those people?
So since this issue became known, there was clearly some appropriate, PPE was being worn. But when you have an incidence of transmission, it also always calls upon you to review what your practices are. So there's certainly been a strengthening of those practices, and we're also making sure that there was a complete separation of the staff that are involved in transferring these high-risk patients of COVID from any other staff that are involved in any other functions. So we are doing our best. It does require additional vigilance, I think, and we've also seen that the rate of infection from overseas travellers is increasing, to some extent reflective of the pattern overseas. We are seeing more infections in our returning travellers, and whilst we regret any transmission event, we need to learn from it and reinforce our infection control practices. And as I said, we've also instituted that separation of the workers, which had been the case and had been reverted for a small bit, and I've addressed that in a previous media conference.
Do you know what sort of personal protection equipment the transport worker who is responsible for the Barilaro cluster of the transmission from hotel quarantine, was he wearing any, or was she wearing any PPE at the time?
Yes, to the best of my advice, we'll issue a statement in relation to what that was, but I think it's really important that this is not about casting aspersions on anyone. I think I've really emphasised here that no one knowingly spread COVID. No one was out and about, and I really appreciate the fact that people come forward and got tested, because that's really allowed us to uncover this transmission event. And if the community comes forth in the numbers, obeys and complies with the rules that have been established, and you can see that the rules that have been established to limit those household gatherings, which we know are real amplification events. We've put in restrictions across hospitality, venue limits on weddings and funerals, and again the rationale there is that in weddings and funerals you're bringing together generally, in some cases, people who don't usually get together. And so you're introducing COVID potentially in other social groups.
But Dr. Chant, surely that is a part of the interview process. When interviewing that person who was transporting workers, what were you wearing at the time?
I can provide the exact detail of the PPE that was being used, but PPE was being used and there were safety plans in place. Obviously, whenever we have an incident, it is appropriate that we reflect and see how we can strengthen it. But it is important to know that the risk overseas has certainly been increasing, and we have seen more returning travellers test positive in recent times.
Over the weekend in Fairfield, that venue has been fined $5,000 as per the public health order, but that venue could have made it up to $100,000 or even more than that by throwing that wedding. Do you think that's enough of a penalty?
Well, that's actually a fair question. And firstly, can I say, when you have a deliberate act like the venue operators, and normally, we thank businesses that are working hand in glove with government in relation to dealing with the pandemic. In this scenario, and in this case, we've got an example of someone who's done it bloody wrong, and that's as simple as I can put it. He puts his own business and his own reputation and that business's reputation at risk, the sector at risk, the broader economy, jobs, and of course, worse, the health of this state. So your question is in relation to the penalties, and I know myself and the Health Minister this morning actually spoke about, is that penalty sufficient, when, to your point, this was such a significant breach, and what the revenue could have been for that operator is something that we have to consider. But my message is to everybody, we can put all the penalties in place, but all we ask you is to do the right thing. No one wins when someone cheats. When everyone else in your industry is actually doing the right thing, and you've decided to deliberately disobey the rules, you jeopardise more than your own business. The fine in itself is irrelevant in one way when you talk about the job losses and the impact on the economy, more so the health of citizens. So we're angry about it. We'll always reconsider what penalties look like, and we haven't had such a breach, a deliberate breach, or as we saw with that particular example. And again, it's a reminder to everybody. We just need to work together to do the right thing. But I'll tell you what, we'll come down hard on those that choose to be deliberate, as we saw that example.
You said that keeping people locked down in the northern part of the northern beaches until the 9th was the worst case scenario. Given we had 0 cases yesterday, there's been no cases in the northern beaches for quite a while now. Is that being reviewed, and will they be taken out of lockdown earlier?
No. Look, the Premier and myself, before she went on leave, along with the leadership team, along with Minister Hazzard and the health team under Kerry Chant, we made those decisions that we were able to lift up the southern zone, get the southern zones out of restrictions earlier, and the risk of course, the northern zone of the beaches. Look, the risk was always there. That was a significant issue, and we had serious numbers come through. They've done the right thing. We have flagged the 9th, and on the return of the Premier, we'll revisit that. But no, there is no option or any decision that will change the 9th or that date.
Can I ask you a question around the health advice for masks?
Perhaps at that time I can just sort of explain some of the differential in the risk of the zones. So this information was provided yesterday, but I think it's really important, and I just extend my appreciation to the Northern Zone, Northern Beaches residents for your cooperation. So we had a significant seeding event. We had a large number of cases at that time. So until we were able to get all of the venues lists and to lock down everyone who had attended those events or were potentially exposed. We know during that week there was a lot of crossover and people were infectious in the community, particularly in that northern beaches. So to give you some examples, in the week ending the 21st of December, there were 67 cases in the northern part of the northern beaches. Now, in a population rate, that is 90.5 per 100,000 because of the population, the relatively low population density in that northern zone, compared to 3 in the southern zone. Now, the following week there were 19 cases, the following week after that 5. It still has a significantly higher population rate, so what we need is sufficient time for any inadvertent transmission, because there may be someone who, look, thank you so much. I'm just outstanding how the community has come out for testing. To see those numbers, it's almost tested 40% of the population in one week and another 25% in the other week. But there may have been people that had such mild symptoms they didn't realise, and there may have been little grumbling chains of transmission established within households, and we just want to make sure we've got long enough to extinguish it totally, so we don't actually have to deal with a grumbling outbreak and to actually consider further actions. I should like to say that the Northern Beaches is a very unique location, a beautiful one, and but a very unique one in the sense that because it is a peninsula, it is more conducive to this action, and also the fact that it had a massive seeding event. And obviously you can imagine the Avalon RSL and Avalon Bolo drew predominantly from locals. Yes, there were some people that attended those events from outside, but the predominant impact was on the northern end of the northern beaches. We did see some seeding into the south because of the flows of people up and down the peninsula, and we also did see some seeding outside to other venues, including the CBD. But the predominant impact was in that northern end of the northern beaches. We're now dealing with a different cluster in Barella, and the tools we use to control it need to be cognizant of the environment and the burden of disease in that, as opposed to the northern beaches, northern zone.
Are you considering banning people from certain areas like Barella, or is there any indication you'll be scaling it down at this stage?
Well, first thing is that if you look at the SCG, and over the period of COVID, it's run something like 20 events and had about 150,000 visitors go through. And as a state, and our venues, like the NRL Grand Final, Origin, or the Everest, or other race days, the Big Bash, we can, and we have shown that we can run events in this state in a safe way that protects our citizens, protect the players, protect those that attend. And most importantly, doing it in a framework that is COVID safe. Now, New South Wales Health, through Kerry Chant's team, have been working with the SCG and cricket to find that framework. And of course, each day we are confronted with other issues. There is now consideration that if it is wet weather, what does that look like? Will people be leaving their zones, their seats, and congregating under the shelter? They're the things that we've got to deal with. You know, what do we do about mask wearing and maybe going up to the bar? Transport on the way in. I know Transport have increased the number of options to get to the SCG, but again, they're the things we're working with the Trust. Can I say this? That we'll also give consideration to the numbers as ticket sales continue, and I will advise today that the SCG in cricket later today will be making an announcement in relation to the test. But we are confident that through the parameters set by health, the advice that government gets from Kerry and her team, that we'll take that all into account. You know, can I just say this? I know, for instance, for regional people, and as the Minister for Regional New South Wales and as the Deputy Premier representing the regions, I know for regional people, the New Year's test is something that is an annual pilgrimage. We love coming to Sydney for this very purpose, and a lot of the SCG members are from the regions. Now, in normal times, I would say that would be fantastic, but I would be saying to people today to consider what's occurring in Sydney with the infections and the restrictions. In regional and rural New South Wales right now, we're enjoying no restrictions. We got to have the summer and the Christmas we were robbed last year because of bushfires and drought. We got to have that this year because of the restrictions we've put in place in Sydney. So the risk would be that if someone from the regions comes to Sydney, that they could take it back to a regional area. So my advice to people would be, think about it, reconsider. Maybe this year isn't the year to come to Sydney to watch the test. And that's what we'll be doing. I'm not going to be enforcing people or putting in some a direction for people not to come to Sydney. But I think people, and I know regional people, use common sense and they will reconsider their visit. But right now, we'll continue to work with SCG through health and its advice to make sure we put on a test that is safe for the players, those that are visiting, and for the state.
Sydney to host another test at Brisbane.
That's all right. Thank you. Just two questions for you. Firstly, can you tell us what Senior Constable Kelly Foster was like as a police officer? We obviously lost her yesterday in that tragic incident, and we understand that she only just recovered from breast cancer and returned to work recently. What more can you tell us about that?
Senior Constable Kelly Foster was a very loved and respected member of the New South Wales Police Force. Her untimely passing yesterday is a great tragedy, both for her family but also for the entire police family. I'd like to extend my deepest sympathies and heartfelt thoughts to her family, but not only to her family, but also to the family of the 24-year-old female who was also with Kelly. Kelly's selfless action in attempting to rescue the 24-year-old woman shows the highest qualities that a police officer can possibly demonstrate, and really vindicates why I'm so proud of the New South Wales Police Force and all of the police officers who work within it. Yes, Kelly had battled breast cancer, but she was totally committed to being a police officer. The fact that her death is being felt so hard by the New South Wales Police Force demonstrates the respect that she held.
Colleagues going through this difficult time.
We provide significant support both to the family and to her colleagues. Later on today, I'll certainly be going to visit her colleagues out at Lithgow just to show my support. We have a great structure in place within the police force to ensure that all of her colleagues are supported. We've provided significant support to her family, and that'll be ongoing. Not only Kelly is part of the police family, but her family as well are part of our family. We'll look after them.
This might be one for you. Could I just get some clarity on mask wearing? So obviously churches, we now have to wear masks. What does that mean for a couple looking to get married in a church? Will they have to wear masks during the ceremony?
Look, we're asking people to apply common sense. Of course, we wouldn't be expecting the couple to be wearing a mask. We would be expecting the couple not to attend the wedding or to go through it or defer and delay if they had any symptoms, or if they'd been at any close contact venues and to comply with any public health orders. But I think we need to adhere to the rules, but we also need to apply some common sense.
To end the rule and the mandatory wearing of masks?
Look, we have a long tail with COVID. Remember, it can pop up, and to some extent it will be a little while before we're comfortable we've got to no community transmission. And at the moment, we are in a high alert period. We've got an opportunity in this Borowa cluster to get on top of it, but that's going to require the cooperation of all of the people the Baralla community and more broadly. So I'd also urge people to think about, given people move about over Christmas and New Year, just for people outside that area, just really think, did you actually pop into that Baralla BWS or the Woolworths there at the times when you were visiting loved ones across there? You might have called in to get some alcohol prior to going to an event or some food. Please just be alert as well. So if we can all just work together to get those testing rates high, to remain in isolation for those ones we've identified as close contacts. If they're contacts of those contacts, can just do that initial action to remain isolated until their contact is a negative test. We will be able to get on top of this outbreak, or it gives us the greatest chance. I can never give any guarantees with COVID, but it does give us the greatest chance.
The question is about masks, though. What standard of community transaction or reaction do you need to reach before masks no longer become mandatory?
Look, I think New South Wales Health has always indicated that masks are best worn in indoor environments. We are increasingly battling COVID and how COVID evolves. So I think it's probably prudent we now get used to wearing masks whenever we're in indoors, because as we get the population vaccinated and as we open our borders, it's unlikely the vaccine will eliminate COVID. We now will need to learn how to live with it. And some of the practices of mask wearing may well be important going forward. It's too early to say, but I think people just need to get used to wearing masks, and we've really emphasised it is about indoor places. We have been pragmatic about gyms, and we've put other controls in places in gyms. And obviously we're pragmatic in other settings where it isn't reasonable for people to wear masks. And also want to indicate, I know I received an email from a person who was really disturbed because it hadn't been clearly communicated around medical exemptions. So can I be clear? If you cannot wear a mask due to your medical condition, please, police are not going to take action against you. And please don't feel that you can't go out and about. And I would urge members of the community, when they actually see someone not wearing a mask, leave that judgment to police or to other enforcement officers, because you never know what is behind that for that individual. So please, again, whilst we want that peer pressure to wear masks, we also don't want to turn it into making people reluctant to go and get their groceries, to seek health care, to go to the pharmacy. So let's be compassionate. I'm saying we'll be wearing masks for however long we need to wear the masks. I don't think I've changed my guidance about wearing masks. I've strongly encouraged masks in indoor spaces. I've indicated that we're going to be tackling COVID or living with COVID for many years. COVID may well become a bit like flu, but that will occur once we have the tool, which is an effective vaccine. So once we've effectively vaccinated the population, we then need to reset and readjust and recalibrate our public health measures. But that's a long way off, and as I said, we have the Therapeutic Goods Administration has not licensed a vaccine for use in Australia. I know that our colleagues in the Commonwealth and the Therapeutic Goods Administration are working day and night to review that data, and I know that they will be acting promptly to ensure that we can deploy vaccine when we're confident it's safe and effective.